Welcome everyone. We want to thank you all for joining us today. Today's webinar will be about tribal resolutions on brain health. This is the second webinar of the American Indian and Alaska Native Resource Center for Brain Health webinar series. We have one more coming up that will focus on traditional Native foods on July 24th, so this coming Friday. At this time, I invite our own Dave Baldridge to open us up with a prayer and welcome you all.
Good morning, everyone. Adanato Sigili Kigage Anahani Iatsibo Nihishki Ianigo Dishkeshti Nigo Hila Ogidada, Great One. We're thankful for Itzai Eloheno, Mother Earth. We are thankful for Atsela, the fire of life. Gift us with healing and the ability to be helpers to others as you would have us be. Wado. Thank you.
Thank you so much, Dave. So IA², a little bit about us. We work to advance both knowledge and practice and promote engagement at all levels. We acknowledge history, rights, cultures, and values of Indigenous people throughout their lifespans. Responding to the needs of those we serve, we generate research, we convene key players to identify novel approaches to cross-cutting issues, and we work to bridge the gap between policy, research, and practice. IA² is one of the 3 funded CDC HBI Component B resource centers. As a resource center, IA² provides technical assistance and resources for tribes, tribal leadership, healthcare, as well as public health staff, urban Indian health centers and organizations, as well as tribal elder service advocates, and many others across the country. Our activities are designed to advance community engagement and help build capacity among tribes and tribal member serving organizations to promote healthy cognitive aging across the lifespan. We work to adapt and develop information products. Our products are designed by and designed for American Indian and Alaska Native communities. IA² has taken a very diligent effort to involve community members, elders, Title VI, as well as our National Advisory Board in the creation and development of the products that we produce. As you can see, some of the folks here on the screen today with us is Dave, as he just opened us up, as well as myself. My name's Marianne, and my colleague Brianna, who you'll hear from here soon. And I'll introduce the speakers here in just one second. Next slide, please, Bree. So I just wanted to touch really quick. These are just a visual of some of the products that we have available on our website for download, as well as available for print. These resources include the Healthy Heart, Healthy Brain flyers and posters, the Healthy Food, Healthy Brain Rat card series, the Dementia Risk Reduction graphic, as well as the 10 signs of thinking or memory changes that might be dementia, and obviously some more. You can learn more about these resources at ia².org. And we're also going to have more products that will be out very soon. Next slide. So now I'm going to introduce our speakers today. So first off, I'd like to welcome Twila. Twila is an independent contractor based out of Belcourt, North Dakota. She was the director of the Tribal Analytic Institute at the United Tribes Technical College in Bismarck. She also has served as a community liaison for the Northwest Area Foundation, a policy analyst for the National Indian Health Board, the director of the Turtle Mountain Community College, and so much more. She was a chairperson of the Turtle Mountain Band of Chippewa Indians and the first female to be seated as the head of the tribal government for 3 terms. Along with performing other duties as required as head of a tribal nation, she also led the effort to recode all of the Turtle Mountain tribal laws, some of which had not been addressed since 1976. Twila holds and has held various appointments. She has visited over 34 countries and continues to serve on our Brain Health Executive Committee. Again, I want to warm welcome to Twila. And next, I want to welcome Chandra. Chandra serves as the program manager for BOLD in the Northwest Tribal Elder Project at the Northwest Portland Area Indian Health Board. In her role as the program manager, she's responsible for supporting the BOLD grant and oversees the overall work for the BOLD and NTEP projects, and she's responsible for assisting the member tribes of Idaho, Oregon, and Washington with capacity building to address Alzheimer's disease and related dementias. Prior to returning back to the health board, Chandra worked as a human resource professional with the Columbia River Intertribal Fish Commission and the National Indian Child Welfare Association. She is a health professional and a social worker with a clear personal and professional goal to do work that will improve the health status of Native American people and bring awareness and education of dementia, brain health, and memory loss, especially to tribal community caregivers, elders, and families. She was raised primarily by her grandmother. Chandra is Klamath, Modoc, and Yahooskin of the Klamath tribes of Oregon and was raised on the Warm Springs Indian Reservation. Chandra is a mother and a grandmother. She recently hosted the Northwest Tribal Brain Health and Dementia Summit that we had the opportunity to attend and participate, and she still continues to participate in our Brain Health Advisory Group. Again, I want to welcome Chandra. So first we're going to have Twila start us off. So I'm going to pass it over to her. Oh, Twila, I think you're muted.
There we go. I'm going to introduce my partner. Without her help this morning, I would have not been able to get anything done. This is one of my 4 granddaughters.
Hello.
Can you see her? Her name is Shania Kekahbah. So she is, we picked she and her sister up in Shakopee, Minnesota yesterday. So yes, I'm a mother and a grandmother. And I tell you what, after all the roles I've ever had, being a parent is one of the toughest. Nobody trains you to be a parent. There's no tribal resolutions that tell you how to be a good parent. They can give you advice as to what they expect you to do, and legally they can ensure under their ability to create law that if you're not what they consider to be a good parent, you face the consequences. But no one teaches you how to be a good parent. And it's easier being a grandparent because you've been through the process once. Anyway, my presentation today, with the help of my partner, is on what is a tribal resolution. And I can start out with the PowerPoint. Did you receive that? Okay. The most critical aspect of the tribal federal relationship is remembering that under the U.S. Constitution, it's the cornerstone of issues that affect American Indians. Okay. And the history of American Indian people, as we can see from periods in the past to now, we have dominated our lands, our homelands. And where are we now? On reservations, a lot in urban areas. But the point is, we had 2 lacks of an immigration policy. Historical shifts, 1492 to the present, and the present is really critical, as was tribal independence, because you can see that the relationship between equals, the removal era, the assimilation period, Indian reorganization, the termination period, and then now we're talking about tribal self-determination. The U.S. Constitution, and this, again, if you don't take anything else away from this webinar, keep in mind that the U.S. Constitution declares that all treaties made shall be made under the authority of the U.S. shall be the supreme law of the land. I know that different ones were asking about the recent decision of the Supreme Court regarding the Indian Child Welfare Act. Hopefully, the U.S. Supreme Court continues to follow the supreme law of the land in recognition of the treaties and what those treaties entail for American Indian tribes. Okay. The significant federal policies regarding American Indians, and I always point out the Snyder Act, 1921, which authorized the Department of the Interior to use funds for the benefit, care, and assistance of Indians throughout the U.S. That allowed for expenditures that are specific to tribes. I know that even in the Northwest, in the Southwest, federally recognized tribes have the ability under the what's called TPA, the Tribal Priority Allocation Process, to get funding based upon treaty allocations. So I just want to point out that Indian Health Service, for an example, is not a gimme. It was something that came under the Snyder Act, which goes right directly back to the U.S. Constitution. Indian Reorganization Act, that too was an attempt to address tribal populations negatively. And then we come into the Indian Self-Determination Act and the fact that tribes could participate in federal programs affecting them. So what does that mean? We have direct service tribes, tribes who receive funding directly, and we have compacted tribes. Compacted tribes came after the contracting of 638 tribes, which was a public law that came into effect under the Indian Self-Determination Act. So despite these different forms of relationships with the federal government, the issue is that it remains the same. It all falls under the U.S. Constitution. Okay. Who are American Indian tribes? American Indian tribes are distinct political entities under the United States Constitution as determined by Article 1, the Commerce Clause, and the Treaties Clause. So that in and of itself points out that we are just not to be labeled minorities. Unlike any other minority, we have a distinctive political relationship. So whatever is available, whether it be under GIPRA or SOS, which used to be part, within the federal government, it's important that tribes have their own way of measurement, and sometimes that includes measurement specific to how they address it within their resolutions. Okay. So, tribal self-determination is the power to determine whatever form of government accommodates their tribal sovereignty, determines membership, administers justice, can exclude persons from the reservations, charter tribal business organizations, collect, maintain, and own research data, and any other power necessary to function as a government. Okay. Talking points, just to recapture some of this. Federally recognized tribes are sovereign, legal, political entities. American Indian people are not only a racial group, but a legal political group. most tribes, as we know it, continue to face levels of poverty much higher than the general populace. But the definition of poverty can mean a whole lot of different things to different tribes. For an example, a tribe may have material wealth in terms of the money they receive from land or from casino or whatever way of receiving it. But at the same time, they may be culturally poor, may not know their own traditions, their own historical cultural background. So all of that is necessary when we look at tribal resolutions. Understanding, recognizing, and strengthening tribal sovereignty and self-determination is essential to the survival of the tribes. Now, real quick, just, the US Constitution is the foundation for the US government. A tribal constitution, written or unwritten, is the foundation for a tribal government. Each tribe is free to determine its own form of government. As I stated earlier, not all the tribes went along with what was called the Indian Reorganization Act and the manner by which they were told they needed to form governments. Those governments were pretty much based upon the Bureau of Indian Affairs creating a particular type of government. And that did not always spell out to be a traditional form of government. However, as it may be, in today's times, a lot of our tribes, particularly in the Great Plains, which are predominantly direct service, they utilize the IRA, whether or not they supported or even provided a yes answer to being an IRA government. They still utilize the typical provisions found in the IRA constitutions. The first is the title of the tribe. And to me, I always found the preamble of our tribes to be emotionally moving. And those preambles, for the most part, were really given a lot of thought back when the constitutions for tribes were formed. And the other parts of the Constitution, or the tribal constitutions, are not necessarily as thought out as in regards to the tribal thinking. For an example, we, the people of, we'll say, the Turtle Mountain Band of Chippewa Indians, determines their jurisdictional land base, the territory. They define their membership. Here it's 1/4 or more. Blood quantum. They define the governing body. In other words, one chairperson and X number of elected officials from each district. They define the title of the head of the tribe, whether it's president, governor, chairperson, chairman, whatever it may be. Then they go into listing the powers of the governing body, including the ability to act on the behalf of the entire tribe. Tribal court comes under Turtle Mountain, as well as all other infrastructure that involves a government. It includes a section on civil rights of tribal citizens, which is not a part of the IRA, but tribes are beginning and have been for the last, I'd say 10 years in particular, looking at their constitutions, recognizing that their constitutions are what enables them to govern, and knowing that when their constitutions were formulated by the Bureau of Indian Affairs, it was predominantly to create a group of people similar to everybody else within the United States. However, the US Constitution basically said there are differences, and those differences go back to the fact that tribes are sovereign. Fundamental powers of Indian trust as set forth in tribal constitutions are important. As I said earlier, the membership, being able to define who a tribal member is. Earlier, I noted that Turtle Mountain was based upon membership of 1/4 or more blood quantum, which is not for me to make comment in regards to it being good or bad. I would have to add, however, that because of the blood quantum, we have a number, particularly children, now who are aging into the system that are 1/4 or more, but not necessarily Turtle Mountain, meeting the Turtle Mountain blood quantum. So what does that mean in regards to divvying up a pie of funds? So that's the power to administer justice. Again, it is very important to remember that tribal governments, when they pass a resolution, they have the preamble, they have the membership, they include, then they include the basic whereas, but most critical is the fact that it's not a letter of support that's being provided. It's a document that is specific to that tribe as a legal political group. And in my estimation, it should be held in high esteem by every federal agency based upon the government to government relationship. So I think that as we talk about the, in some cases, tribal resolutions can and do waive sovereign immunity, but it's a rare case that they do so when it comes to federal funds. Again, why? Because of the government to government relationship. It's different for a tribe to get involved in a business venture and waive limited immunity. But I rarely know of a tribe waiving immunity with a government program. As I said before, it's a tribal resolution is not a letter of support. It's based upon the issue of tribes being political entities with sovereign powers, and that power that they possess allows them to govern just like a state would, or in some cases, as would the federal government. Although the federal government and programs does not do resolutions, I'm not sure how many federal programs out of the 12 federal departments, I don't know to what extent each of them require resolutions from tribes, and if they did, would those resolutions be passed through or direct from a tribe? Those are, I think, concerns that need to be addressed by the organizations such as the Northwest. And I know that the Northwest Area Indian Health Board has done tremendous work in that area in and of itself. So with that, I've concluded my presentation. I'm anxious to hear what Chandra has to say.
Thank you so much, Twila. And Chandra, feel free to go ahead and get started whenever you're ready.
All right, can everybody hear me?
Yes.
Oh, good. Okay, so thank you, Twila, for all of that really good information. It's always a good reminder for all of us to hear about the relationships with our government and how our tribes are out there doing all the hard work for us in our communities. So I'm going to talk about the health board, the Northwest Portland Area Indian Health Board's resolution process, and it's going to be more geared to how we would submit and start a resolution for some of the program work that we were doing. So I'll just jump in right there. So this is the mission statement. So the health board was established in 1972. And it is a nonprofit tribal advisory organization, and the health board serves the 43 federally recognized tribes in Oregon, Washington, and Idaho. And each tribe appoints a delegate via a tribal resolution. So as we're talking about resolutions, I wanted to share that. And we meet with our tribes quarterly. To talk about the work that we're doing, and they direct and oversee all of the activities of all of the programs and the staff operations work that we're doing at the health board. So what we do at the health board, we have a strategic plan, and in that strategic plan, it covers these 4 areas. So health promotion, disease prevention, legislative and policy analysis, training and technical assistance, and then surveillance and research. And then the health board also houses a tribal epicenter, and there's several health promotion and disease preventions projects there. And we do a lot of policy work as well. Next slide. And I only have a few slides. But okay, this is a map of the Northwest tribes. So we have Oregon, Idaho, and Washington. There's 29 tribes in Washington, 9 tribes in Oregon, and 5 tribes in Idaho. This is just kind of a visual of what our area looks like. We're in Portland, so we're kind of near the number 41, maybe a little bit up on the Oregon. That's where the health board is, in Portland, Oregon. Next slide. So I just wanted to share an executive timeline. So we've been around since 1972. On my right side, it lists the executive directors, the history and timeline of our executive directors. Our current executive director is Laura Platero. On the right, or on the left side, I guess that was my right side, is the chairs. So we have officials, 5 officers at the for our executive committee. Our current chair is Nick Lewis from the Lummi tribe. And again, the officers of our board are delegates. So again, they've been appointed from their tribe through a resolution, and then they've been voted into these positions. So our current chair right now is Nick Lewis. Next slide. So I just put some bullets up for some talking points. And as Twila had shared, about the policy and how resolutions can be kind of those building blocks and communication through legislation and congressional appropriation. Many of them come from the ideas of tribal communities. Again, I'm going to talk about the program side and how we would do a resolution at the health board. So not always do our resolutions stay solely at the health board. If they're more policy related, they would then go to AT&I, the Affiliated Tribes of Northwest Indians, and then they could move on to NCAI and to the National Congress of American Indians and NIHB, the National Indian Health Board. The folks from our organization that would be part of those resolutions at that level would be our executive director and our senior policy advisor. They would attend those meetings where our resolutions would be brought forth. So the board's resolutions sometimes are used to establish the board's position on an important issue as well. And again, we will bring a resolution, a drafted resolution to our delegates and our health board, have them review, and then they would, move forward with how they want to proceed. Next slide. So our resolution process, I kind of just put some questions there so I could, answer them. So who can submit a resolution? So at the health board, we have kind of a guidelines for building the resolution, and then a format, and then kind of how it's routed through. So the need for a resolution is generally driven by the program planning and the development, and that's information that's clearly transparent and identified and available to our staff. So all of our proposals at the health board's programs will be reviewed and formally approved by the delegates or the board of directors before we submit for any funding agencies or grants. And we want to know that if a tribe in our area is applying for funding, and we were also expressing interest, we wouldn't apply for the funding that one of our member tribes is applying for. So we have the board has clarified the application of the policy of how we submit our grants. So we have a few different types of when a resolution would be needed. So a new grant proposal, so grants, cooperative agreements, federal, state, and foundation sources, we would need a resolution. Any new contract proposal, we'd need a resolution. Some subawards where the board is the serving recipient, and then we're going to do a subaward, we wouldn't need a resolution unless it was requested either by the health board or by maybe another sponsor. Again, other subcontracts, the same process. We wouldn't generally need a resolution unless requested or required. If we have supplemental funding on existing awards, we would need a resolution if it's over a specific dollar amount. And then non-competitive foundation funding, if the proposal requires, then we would also need a resolution on that. So the general guidance for our resolution development is we do not include the specific amount of the funding in the resolution, but we try to put as much information about the amount of the funding. We don't generally have the specific date or contract, such as like it's a 3-year grant or it's a 5-year grant. More so, we try to put in just what the scope of work would be, the title of the grant, and maybe who the funder is, and then who our target reach is. So we have a template that we use, and it has some specific content that is required. So there is 5 required resolution clauses that cannot be altered. They need to remain in every resolution. And then once those 5 sections are included in the resolution. As we're building the resolution to fit a proposal or to present, then we can add in the information about either the funding source, the sponsor, anything about the announcement, anything about the project. Also, when we do resolutions, if we want to say like partner, and I'm currently working on a resolution that I'll be presenting to our health board at one of our October board meetings, just to bring forth a partnership or a commitment of working with the Alzheimer's Association, for example, right? Like we want to share that information of what the Alzheimer's Association's work would look like with the health board, and then we would submit a resolution that would include those 5 components of the whereas's content, and then put in, any other information that we think is important for our tribal members and member tribes to know about. So where the resolutions go. So a project director or project manager will draft up the resolution, put it into the proper final format, and in a final draft, and we would submit to our grants manager. And then after that review, the grant manager then routes the final document to our executive staff or executive coordinator, who would then coordinate with our management, most likely like our deputy director, and they would review that, and if it's accepted, then this would be presented to our executive committee for consideration, and then it would then be brought forth at our next quarterly board meeting. So whatever that quarterly board meeting time would be, we meet in January, July, October. January, April, July, and October. So once that resolution has then made it to the quarterly board meeting, or it would be then handed off to our resolutions committee, and those committee members would be delegates. Again, all of our delegates will sign up to serve on one of our standing committees or ad hoc committees. So we have a resolutions committee. They would review the draft of the resolution, and then they would, have discussion about it. If they need further information, they would then, reach out to either our deputy directors team, which then may lead back to the project directors to get clarifying information. If the resolution is approved, the resolutions are presented to the entire health board for ratification. And if being routed to one of like AT&I, then that would be the executive coordinator and the role of our management and leadership there to prepare and present that to AT&I and put it on their resolutions and in their format. And then it would be submitted to AT&I. There's not a resolution is not always needed. Sometimes we might just have a letter of support from an organization. So if maybe another organization is seeking to work with with the tribes, and it falls within the scope of work or the strategic plan of the health board, it may be decided that the health board would write a letter of support to the organization, and that wouldn't have to be brought to our delegation as a resolution, and then it would just be more of a letter of support. Another option is the signed letter by delegates. Again, we just would prepare a letter and bring it forth to our executive committee, which then might take it to our full health board for review, and then that letter could be signed in place of having a resolution. But it just depends again on if we need that content that's required in those first like 5 whereas. And then I think next slide, I'm not sure if that's the last slide or not.
I think this is your last slide.
Okay, no, that's fine.
Yeah.
I was just gonna say I was gonna share, I can read a few of those whereases so that you can kind of get a feel of what the resolution sounds like. So the first one will say, these are the required ones. Whereas the Northwest Portland Area Indian Health Board, hereafter NPAIHB, was formed in honor of our elders' teachings to realize the wellness of the seventh generation, our grandchildren's grandchildren. Whereas we were established in 1972 as a tribal organization under the Indian Self-Determination and Education Act, the PL 93-638, and has a primary purpose to make known the needs and desires of American Indian and Alaska Native people to federal, state, and local agencies in formulating policies, programs, and establishing priorities in providing and delivering services, which it is incumbent upon the United States to provide pursuant to the trust responsibility and treaty obligations made to federally recognized Indian tribes. And whereas the NPAIHB is governed by the 43 federally recognized member tribes in the states of Idaho, Oregon, and Washington, in accordance with the NPAIHB Constitution and bylaws adopted in July of 1996, which have been amended in 2021. And whereas the NPAIHB's mission is to eliminate health disparities and improve the quality of life of American Indians by supporting Northwest tribes in the delivery of culturally appropriate and high quality health care. And then we have the by finally it resolved by the chairman is hereby authorized and directed to execute this resolution and any documents connected there within, and the secretary is authorized and directed to attest to the certification. So those are the 5 standing whereas. So when I'm drafting one up, for example, to work together with another program, I have one that I'm going to submit that's going to have a title of supporting NPAIHB and the Alzheimer's Association to work together on community programs for dementia education and training for Northwest tribes and caregivers. So including in those, whereas, I might add some information about the organization that we're going to be working with. So the Alzheimer's Association, I might put in some statistics or some important information that I think will be valuable to the tribes, and they can determine if it's valuable or if they want more information. But it would just identify those additional whereases would just be very specific to maybe the scope of work of the work that we would want to do with the partnering organization or agency. So I think that's a little, that's it in a nutshell of kind of our resolution process for, getting them submitted to our member tribes for program work and support.
Thank you so much, Chandra. So yeah, we worked very closely with Twila and Chandra on our development process of our sample tribal resolution, and it was pretty much going symbiotic at the same time that they were working on their sample tribal resolution. And that's kind of what I² has wanted to develop, was more so a generic version of a tribal resolution that does address ADRD, but it will also be able to be something that tribes can develop themselves based on some of the facts that we have, or whatever it has, whatever is based on the tribal needs. We want everything to be based on what the tribe needs itself. So the tribal resolution package itself, it was developed to address Alzheimer's disease and related dementia, ADRD, in tribal communities. And the sample tribal resolution is a mechanism for a tribal governing body to address program and or policy matters that affect the welfare for American Indian Alaska Native governments and communities, specifically those affected by ADRD. And the language of the resolution should reflect the specific tribal government's preferred words and identification of their people. We definitely encourage the tribal governing body to modify the sample resolution to tailor it for their community. And there are 4 parts to this document that we have. It's to have a created tribal resolution to address ADRD in tribal communities, and also to have language that's specific to the resolution that can reflect tribals government's preferred words. And yeah, we really encourage the tribe to be able to use that in their own nature. And there's a cover letter explanation, there's the sample resolution, there's information about things that we have found that is based on what they can use. And yeah, there's just the facts for the resolution. And Marianne, I don't know if you have anything else that you want to add to that.
Yeah, I think that that's good. If you want to, we'll open it up for Q&A. If anybody has questions for our panelists, feel free to either drop them in the chat or raise your hand and we can take you off of mute. Let's see. Oh no. Yes, so what we'll, as far as a copy of the PowerPoint and things like that, we'll actually have the recording and the PowerPoint available on our website just shortly after we finish off today. And the resources and pamphlets that we discussed, I'll have Bree drop that in the chat here. And I think otherwise, we'll just move on to the next slide. And if another question comes in, we'll do our best to answer that. So again, I want to say thank you to our presenters today. And thank you to Dave again for opening us up. But before you leave today, I wanted to provide you guys with a few ways that you can participate. IA² is working to put together a library of stories, including the perspectives of American Indian Alaska Native elders, their caregivers, about memory loss, dementia, caregiving, or various taboos and misconceptions that surround memory loss and dementia. If you participate, you can receive a $30 gift card. Depending on what you're interested in, or if you're interested in both, feel free to scan those QR codes there on the screen. And you can see more of the information about those opportunities. Next slide, quick brief.
Great.
And we do have one final webinar coming up in the series. Today was our second of the third, and coming up on Friday is the Traditional Native Foods and Brain Health webinar. Heidi Robertson will be giving us a presentation that discusses traditional foods, nutrition, and caregiving, and will focus on how traditional foods can support brain health in Native communities. So if you've not done so already, I really encourage you to sign up. And again, you can do that by scanning that QR code there on the screen. And then last slide. Again, I want to thank you all for sticking with us today and enjoying this really great presentation. Thank you to our speakers, and Dave, if you would like to close us out, I'll pass the mic over to you. Did we lose Dave?
Asked him to unmute. There you
Sorry, I'm here. A short Cherokee benediction. We-he-yo, we-he-ya, ya we-he-ya, yo hey, you're up there and we're down here. We-he-yo, ya we-he-ya. Thank you.
Thank you, everybody, and have a nice rest of your day.